All right, so another way of trying to correct blood supply to a bone, let me say, is mostly used for what? All those osteonecrosis, you know, or some people call it avascular necrosis, right? So if the blood supply to a bone is not kept optimal, you understand, I want to actually increase the blood supply to the bone. So this is what is known as a core decompression, core decompression. All right, so for a core decompression, it's just a procedure because you want to treat what? Avascular necrosis. That means blood supply to a bone is kind of like being tampered with in the early stages. Okay, so it's most commonly used to treat what? If this avascular necrosis is occurring in the hip or the shoulder. So the goal is to relieve the pressure in the bone, all right, then stimulate the bone to produce more blood vessels. So what happens in this? In avascular necrosis, blood supply to the bone is what? Being disrupted. So the bone tissues are not receiving nutrients, oxygen and stuff, so they're kind of like dying off, you understand? So of course, if you leave it, if it progresses, the joint will collapse. Okay, so how this core decompression work? A small tunnel is drilled into the affected bone. You drill into this place, you understand? So sometimes you might even put bone grafts or stem cell therapy. So even if you don't put it, just by that drilling, it will stimulate the bone. Okay, it will relieve the pressure, then stimulate the bone to produce more blood vessels just by that drilling. Okay, so procedure snapshots is general or spinal anesthesia can be used. All right, guide wires or reaming tools to access the necrotic area. Then imagings like what? X-rays, just to what? Confirm where you are to place. So who benefits from this is mostly people that are in the early stage of avascular necrosis, or your own avascular necrosis is not because of what? Injury. Okay, maybe because of you have been abusing alcohol, sickle cell anemia, or you have been using corticosteroids for a long time. Okay,